Can you please give a short brief of of yourself?
See, I am now 41 years old, and I've done my MBBS from Guwahati Medical College from 1997 batch. After that, 2003 to 2006, I did my MD medicine, general medicine from Karnataka, a place called as Davangere. It's near Hooghly, in a medical college called as JJMC. Subsequently, 2007 to 2010, I did my DM neurology, which is the super specialty training in Sri Ramchandra Medical College, which is at Porur in Chennai. And from 2012, I went for an epilepsy fellowship in Sri Chitta Tirunal for a year. That is the SCTIMST, which is in Trivandrum. And regarding my working experience, I was a senior consultant neurologist in Apollo Hospitals, Chennai, from 2013 onwards till 2019. So for a long time, I have been working in Apollo Cancer Hospital and Apollo Greaves Road also.
So, okay. The first question is, how many years of experience do you have in treating patients with Parkinson's?
So I have at least now 13 years of experience. I passed my DM neurology in 2010. So almost like now 10 years of active clinical practice. I have. So 10 to 13 years, you can say.
Okay, all right, sir. And now the next question is, what are the early signs, causes, and the risk factors of Parkinson's disease?
Yeah, so there are three questions here. One is the signs, another is the causes, and the risk factors. Okay.
Yeah.
So we will take the signs first. So you have to understand Parkinson can present in many ways with us. Okay. Many times the commonest way it present is because of motor symptoms, or what we call it as like tremors, or shivering in general words. So if that is there, the person will see directly. I mean, anybody, family members will be able to pick it up early, and the diagnosis is early. Okay, they may also have, without tremors, only stiffness, or what we call it as rigidity and bradykinesia, that is slowness of the movement. And many times that may be missed even for a year or even for 17-18 months, because family will think it is all age related. Okay, so this group of patients, the diagnosis may be delayed, and this is one way of presenting. And third group, they will present with pain. So they may go to an orthopedician or a physiotherapist with various kind of body pains, which is again because of the muscle stiffness, which is because of Parkinson's disease. There are certain non-motor symptoms also. So like other non-motor symptoms, like we call it as apathy or depression, anxiety, fear, all that. I was talking to Times of India and Indian Express today. So I was talking to all these other issues and psychological issues in COVID pandemic, and how the PD patients and what all their special needs in during these difficult times. So that is regarding the science. Regarding the etiology or the cause, what you asked, so we don't know the cause, but there are certain risk factors we know, like genetic factors. Males, it is more, almost twice as common in males as compared to women. It is said that maybe the hormones, women hormones may be protective for Parkinson's patient. So that is one thing. Then third, there may be risk factors like environmental risk factors, like exposure to pesticides, even drinking water from the well. That is also has been found as one risk factor in rural population. Obviously, in urban population, we don't have drinking water wells, but in rural population, they find maybe because of pesticide exposure and other things. And then there are genetic causes also, or genetic, what we call it as genetic PD, which is almost like 10% of all Parkinson patients. Like 1 out of 10 patients will be like genetic Parkinson's. Those are the genetic causes of Parkinson's.
Okay, all right.
Yes.
So now, according to your data, I mean, you treat the patients. So how many people are suffering from this disease in India right now?
So see, the problem in data in India is it's very variable. We do not have very large data collection. So if you see in general, they say that around 10% of the world Parkinson population is in India. Now, if you take on a world level, we have around 6 million people in overall, to 8 million or 10 million people, Parkinson patients all over the world. So if you take 10% of that, that becomes somewhere around 6 lakhs. Okay. So at present, maybe in our country, we have around 6 to 8 or 10 lakh people suffering for Parkinson's disease. And above the age of 65, in general, you can say almost 1% of the patient. So if you take 100 people above, 65 years of age, almost 1% of them, maybe one person may have some signs or symptoms of Parkinson's. I do not have any Tamil Nadu data. I don't know any of the local data. I had a quite great discussion about that today. The problem is that we only have prevalence, okay, crude prevalence. So this also, if you want, you can mention that various ethnic prevalence, like somebody has done a study in Kashmir or in Bengali population in Northeast or in a Parsi population in Mumbai, like that, or in Bangalore. So these subgroup of studies or smaller studies have given us, some data, and according to that, the variable prevalence is varies. As low in Kashmir, it can be like 15 or 17 per 1 lakh. Okay, so per 1 lakh population, it can be like 15 patients of Parkinson's disease, whereas in a Parsi community in Bombay, it can be as high as 300. So you see the inhomogeneous distribution, 14 and 300. Where is the difference? It's a huge difference.
Yeah.
That is the reason. I mean, it's a quite variable prevalence and across the country, across ethnicity, because it's a disease which is related to genetics. So maybe there is a different risk factors or environmental factors or dietary factors which we don't know yet completely.
Okay. Okay. The next question is, what best tips you would like to give patients to feel better with Parkinson's?
Okay. So I think the best what they need is TLC, tender love and care. You know, so that is most important. Listening to them is very much important. Anybody can treat Parkinson's disease. You do not need a movement disorder specialist to treat Parkinson's disease. Even a physician, and this is a strong word which I say, even a general physician or a general neurologist can treat Parkinson's disease as well as a movement disorder specialist. But I think where the fact matters is that as a specialist practitioner, I can give more time to that patient. So I can do certain tests or certain examinations, check the patient for a more longer period of time. That gives them a feeling of importance, and care is more important. Medications, in the end, we may write the same prescription, but it's not how you write the prescription, but how much time you spend listening to them, especially their psychological issues or their issues related to their movement. All those things we have to see.
So, is it actually totally treatable, or just some people do not survive?
So I would say Parkinson. Yeah. So no. So see that is where there are two different questions in this. Parkinson is a progressive neurodegenerative condition. It is not curable. Okay.
Okay.
There is no cure for Parkinson's disease. Same way, diabetes, you don't have any cure, right? You can only treat with medicines. So there's a lot of controversially cured diabetes. Okay. So similar way, there is no cure for Parkinson's disease. But if you give medications properly to these patients, then what you can achieve is that you can have a better control of their quality of life, their movement, their tremors, their stiffness. So they are better in terms of that, and they do not develop complications. Now, Parkinson's per se will not reduce the life expectancy of a patient, directly. But usually in advanced Parkinson, they have other complications, like they may have aspiration, swallowing problem and aspiration, or they may have repeated falls. And when they fall repeatedly, you may get injured in the head multiple times. You may have a blood clot in the brain, which may lead you to an ICU care, and then you may have certain other associated infections and other things which can reduce the duration of your life, or make you more morbid, or make you more physically dependent on others. Okay, so the complications because of the disease progression is what makes the people go down, and they may lose memory. So what we call it as cognition. So when the cognition is impaired, then also these patients can have problems.
So how long a person can live with this disease?
I have like patients they can be even do very well with even 30 years, 40 years with this disease. Okay, so every patient is different because their genetic makeup of the patient is different, and most importantly, how the disease will progress in one individual, it can be completely different from another individual. Now, for example, there is a group of conditions called as Parkinson's plus disorders. Okay, so those group of patients, that is not Parkinson's disease. That is called as Parkinson's plus disorders. Okay, PD plus, and you can mention it. Those group of cases, they will progress very faster. And within, maybe we may lose them between 7 or 10 years of the disease onset. Okay, whereas a pure good variety or a garden variety of Parkinson's disease can be living very healthily up to 30, 40 years. It all depends on how much your disease progresses. So the outcome, long-term outcome, depend on mainly on how much is your disease progression, how much is the response to your treatment, which is levodopa or syndopa or other medications. Okay.
Okay. So, can you please explain the stages of Parkinson's?
Yeah, so I mean, stage is there are various way of doing, and we call it as modified Weinania staging, which has been there for ages now. And basically, in general, for a general population, it starts with one side of the body. Okay, then it can involve both the side in stage 2 or 3, and then when you reach stage 3, you may start developing balance problem. So anybody, even if he has a mild tremor or a mild Parkinson, but has got a balance issue, directly becomes stage 3 Parkinson's. Okay. And then you may go to, so you may think that, okay, he just has a small one hand symptom or a one side symptom. But if that patient is actually worse than a patient who may have both the side symptoms, but does not have balance problem. Okay. So it is so important. So we usually don't try to stage patient, because as soon as you say staging, there's a lot of stigma with this staging. Many times patient ask us what stage I am. We say you are in the best of your stages. That's it. You are doing well. You are in stage 2, like that. As soon as you say stage 4, no. Oh, stage 4, people think stage 4 cancer, and they immediately start correlating that I am very bad. It's
Mhm.
not like that. So I think the staging is something which we need for research purposes and for our usage. But when it comes to the patient, it is better to avoid using the staging. I never write staging in my diagnosis. Only I will write Parkinson's disease, because I don't want to make their mental, because tomorrow the patient can become better also. You don't know. So why to label it like that?
So, the last question is, what are the newest and advanced treatment options available in India?
So that's a very good center. We have, can you see this
Yeah, right.
brochure?
Mm-hmm.
Okay, so we are running something called as, I am the program in charge for the last 2 years. I am doing it, and we run here something called as Comprehensive Parkinson's Disease Clinic (CPDC). Okay, Comprehensive Parkinson's Disease Clinic (CPDC), and I am the in charge of that. So in this program, what I am doing basically, I am trying to see patients and give a comprehensive care to them. So the advanced treatments, like there are two advanced treatment. One is the apomorphine injections, which have come, and a pump which has come. We are trying to provide patients who have advanced disease or patients who have motor fluctuations, which means that they take their medicine, they are better for 2-3 hours. Again, the medicine effect goes off and they are very much worse. So there is a lot of fluctuation, what we call it as on-off phenomena. And these sort of patients actually helps, they are the patients who can be, are the candidates for this kind of targeted therapy. Okay. So see, there is no cure for Parkinson's disease. So similar way, we have to give the routine regular medications. But as the disease progresses, medication effects become lesser and lesser, and the same medications cause more and more side effects. And at this stage, you need to bring these advanced or targeted therapy like apomorphine pump or injections, or a surgical treatment like deep brain stimulation. Like I did a DBS day before yesterday for one of my patients. Patient is still in the ward. It's called as deep brain stimulation, which is like a pacemaker for the brain. What we call it as a brain pacemaker. Okay. Okay, so this brain pacemaker, it basically comes as like a heart battery here, and then that battery will have a wire which will go from the back of the neck, and we will place two wires inside the brain in a specific area, very minutely. We have to place it with zero degree of error in an area called as subthalamic nucleus, or STN. And when we do that, and when we switch on the battery, it will give the current in that area, a very minimal amount of current, and that helps to smoothen the symptoms. These on-off symptoms, it helps to smoothen. But having said that, DBS is not a cure for Parkinson's disease, but basically DBS helps us to improve the quality of life of the patient and helps us to decrease the complications of the medications and these drug-related side effects, namely. Okay.
Okay, all right. Dr. Agrawal, thank you so much.